Posterior nasal neurectomy is a minimally invasive surgical treatment for intractable recurrent allergic rhinitis or vasomotor rhinitis. Those are refractory to medication. Target mainly posterior nasal nerve, also known as short sphenopalatine nerve, and another name is the posterior superior nasal nerve. These are the branches of the sphenopalatine ganglion. This posterior nasal nerve contains sensory fiber from the V2 as well as it contains the parasympathetic fiber through the nervous intermediates, that is facial nerve, which help in the submucosal or mucosal secretion of the nasal secretions. So this decrease the secretions of the nose if we cut this posterior nasal nerve. Indications are mainly refractory allergic rhinitis which not responding to maximal medical therapy, non-allergic rhinitis, that is vasomotor rhinitis, profuse watery rhinorrhea is the main symptom, and failure of other procedure like turbinate reduction. Goals of the surgery are reduce parasympathetic innervation, decrease mucus secretion, reduce nasal congestion and repetitive sneezing, and preserve sympathetic fiber to avoid dryness. Steps of surgery are lateralization of middle turbinate, identification of sphenopalatine foramen just posterior to the posterior attachment of the middle turbinate. And you can see between the floor and roof of the maxillary sinus, just inferior to the sphenopalatine bundle, there are 2 to 3 branches of this posterior nasal nerve. You can see in this picture. I am stretching or cutting. Just you have to elevate, and they will cut it. Just cut by the stretching only. There are 2 to 3 branches of this nerve. This posterior nasal nerve having 3 branches. First is posterior superior lateral nasal nerve. Second is posterior inferior lateral nasal nerve. Third one is posterior nasal septal nerve. These are 3 branches. You can see in this video also. There are mainly 3 branches are seen in the endoscopic submucosal view. If patient having severe watery or rhinorrhea with postnasal drip, you can add pharyngeal neurectomy with this procedure. That will completely decrease the rhinorrhea from nasal congestion. So this added procedure, pharyngeal neurectomy, this pharyngeal nerve is also branch of the sphenopalatine ganglion. This nerve emerges from sphenopalatine foramen and goes into this palatovaginal canal. At palatovaginal canal, you can cut this nerve. That is called pharyngeal neurectomy. That is added procedure with posterior nasal neurectomy will definitely help to decrease the postnasal drip and rhinorrhea. Complication of this posterior nasal neurectomy are epistaxis, dry nose, crusting, numbness of the palate, and recurrence if incomplete resection. Outcomes are significant reduction in rhinorrhea, sneezing, nasal congestion, symptom relief more than 70% in long-term studies, and this can be combined with turbinoplasty with pharyngeal neurectomy. This definitely help with the decrease the symptom in 70% of cases.